Bladder cancer is a serious illness, but early diagnosis can mean surviving for a good many years. Every year, over 10,000 people in the UK are diagnosed with bladder cancer, both men and women. If you're watching this video, you or someone close to you may be one of them. We are going to take a journey together to learn about the symptoms, the diagnostic tools used, and the treatment options available. My name is Danielle, and with me is the consultant urological surgeon, John. We have a urology clinical nurse specialist, Helen, and we also have some patients here today as well. So we have Barry, Alison, Janet, and Nigel. So Helen, what are the main symptoms of bladder cancer?
The main symptom of bladder cancer is blood in the urine. Can't emphasise sort of strongly enough how important it is if you have just a single episode of blood in the urine to go along to your GP and talk to them about that. Other than that, it can be sort of persistent urinary tract infections or signs of urinary tract infection, so frequency of going to the toilet, pain when you're passing urine, you're treated with antibiotics and it's not clearing up, and actually a test that's sent off to the laboratory doesn't show an infection.
Okay, and are they different for men and women?
No, a lot of people say that men don't often report symptoms as readily maybe as women, but other than that the symptoms are the same.
Okay.
The message is to try and look before you flush. There's been some campaigns recently about blood in your urine, blood in your pee, and looking before you flush the toilet to check that out.
If someone has any of these symptoms, does their GP do the tests, or do they immediately refer them to the urology department at the local hospital? Or
the GP may do a test in the surgery, a urine dipstick test to see if there's any non-visible blood in the urine. But if there's been visible, obvious blood in the urine, they can just refer you straight into your local urology service for tests.
Okay. When the new patients arrive at hospital, what are the main diagnostic tools used? So I think that's possibly for yourself and John maybe.
Most patients, when they've been to see their GP, will be referred on a fast track pathway. So the appointment to come through to see the urology team or the diagnostic team will happen pretty quickly. And when you come to the clinic appointment, the first thing the staff there will do is just talk to you. And they'll talk about what's been going on, what symptoms you have, and they'll talk a little bit about the investigations. They'll take a sample of your urine just to double check whether or not we can see any blood in your urine when you come in. They'll also look for infection to make sure there's no infections around. And then the mainstay of investigation for blood in the urine is an examination of the bladder, and we call that a flexible cystoscopy, and some form of imaging. So that's radiological examinations, an ultrasound scan or a CT scan, to look at the kidneys and the tubes connected to the bladder called the ureters. And we usually pick which test we're going to do depending on whether or not we see any blood in the urine. So if you can see blood in the urine, we do a CT scan as the go-to test. The flexible cystoscopy is a small telescope examination of the bladder. We do it under a local anaesthetic, and that means that we put some jelly at the tip of the penis and inside the urethra, and a small telescope goes inside the bladder, and we look directly at the bladder lining, looking for abnormalities. With the scans, they're obviously looking for pictures of lumps and bumps that shouldn't be there, and that's the purpose of the scans.
Because the flexible cystoscopy that you mentioned about, is that painful, and how long does that procedure take?
Well, I mean, it'd be really interested to get, the patients who've been through its perspective, and I'm sure they'll feedback. But from our perspective, it's really well tolerated, and in terms of doing the procedure, it takes about 3 to 4 minutes in total for the telescope to go in and have a look around. Sometimes a little longer if there's something suspicious there. But the aim is not to cause discomfort. Okay.
And are there any other sort of type of tests that can be done?
So there are other tests that can be done, but those tests that we've talked about in terms of the scans and the look inside are the main investigations that we do.
Okay. And I understand that there's something called a TUR-BT. I don't know if you could explain a bit more about what that is.
Yeah. So if we look inside the bladder and we find an abnormality there, then what we need to do is confirm whether or not there's a cancer there. And the only way to do that is to remove the tissue that looks abnormal and look at it under the microscope. And the procedure that we use to do that is called a TUR-BT. The TUR-BT is an acronym, and it stands for transurethral resection of bladder lesion. And what that means is that we, under an anaesthetic, so you can't feel anything, we put a telescope into the bladder to look again at the bladder lining, and then if we see the abnormality there, we take that away. Now we've got special instruments to be able to do that, and sometimes we use electricity afterwards just to seal the blood vessels to make sure there's no bleeding afterwards. But for most patients, they will come in on the day of their operation and they will go home either the same day or the day after the procedure. During that operation, your surgeon will make an assessment of what your bladder looks like and how suspicious the area is. And they may afterwards actually give you some chemotherapy into the bladder as an additional treatment at the time after your operation. But they'll always talk to you about that.
Okay. So we've mentioned quite a few different tests there, and presumably you'd be in a position to give a diagnosis. And is that given to the patient at the clinic, like with recommendations, or how does that work?
Yeah. So once we've got the results back from the pathologist, the patient will be sent an appointment to come into the clinic. In our team, those appointments are done through the cancer nurse specialist team. So patients will come in, they're welcome to bring family members with them, and we suggest it's quite a good idea to take somebody with you to your hospital appointments generally anyway. And we'll sit and talk them through the results of the lesion that's been removed and what we need to do from there on in.
Yeah, because I understand as well that at that point you talk about something called grading and staging. So what's that all about?
So bladder cancer is a term that covers a lot of different sort of situations really, and cancers are subdivided into two main groups: invasive bladder cancers and non-invasive bladder cancers, and they're both very different diseases and treated very differently. The grade and stage relates to information that the pathologists give us that tells us how worrying these bladder cancers are and what treatment people might need subsequently. Grading is about how abnormal the cancer cells are when the pathologist looks under the microscope. And grading for bladder cancer is from 1 to 3, 1 being low grade, 2 intermediate, and 3 being high grade. Staging tells us how far a lesion is penetrated into the various linings of the bladder. And you'll hear terms like TA, T1, T2 type tumours. And that's telling us, as I say, how far those tumours have invaded into the lining of the bladder. And that tells us which category people fall into, either the invasive type or the non-invasive type of cancer.
Okay. Is there anything else that you'd like to add about that, John?
No, I think the main thing to say is over the period that you go through this pathway up to this point, you receive an awful lot of information, and I think your specialist team will always talk to you about everything. Don't worry too much about the numbers if you can't remember them, okay? The main principles are, how aggressive is your abnormality likely to be, and your team will be worrying about what's the best treatment option to give you the best outcome afterwards, okay? And that's why we're doing the investigations.
Okay. So that was really good. We've learned a bit about the diagnosis of bladder cancer. I thought we could talk to a few patients about their experiences so far. So if it's all right, maybe if we start with you, Alison. So what were your original symptoms?
The only symptom I had was blood in the urine, which I noticed. I didn't have any other symptoms, no other issues that I would have noticed. So I went to the doctor and they gave me a test for an infection. I didn't have an infection, so they referred me to the urology department.
Okay. Janet, I believe that your symptoms are slightly more difficult for you.
Well, I noticed a tiny amount of blood in my urine, but it happened only every few months or so. I was late 40s, so I just assumed that it was menstrual blood or related to the menopause. And it was actually probably 6 to 12 months before I actually went to the GP about it.
Right, okay. And Barry as well, just to come to you. From a male point of view, what were your symptoms?
Surprisingly, I didn't have any symptoms at all, listening to what other people have had, other than I was under a urology consultant for the previous 7 years for prostate cancer. And as far as I can recall, he decided that something else was going on and decided to have a look inside the bladder. And that's when they found it.
And then Nigel, what diagnostic procedures did you have and what was your experience of those?
Well, the first one I had was the renal ultrasound, which was just purely external. No problem, no time, just a few minutes. Then went on to the flexible cystoscopy. As Jonathan said already, it's a camera down the penis. They put a numbing jelly on. Apart from a bit of discomfort, the whole process changing, etc., less than 20 minutes.
And then, because Alison, with the procedures that you must have had, did you have any side effects?
I didn't really have any side effects. The flexible cystoscopy was fine. I didn't feel any pain. I didn't get any infections. It's a bit more complicated with the TURBT because you have an anaesthetic as well, so that made me feel very tired. And on one occasion I had to have a catheter for a period of time after the procedure, but I would say it was all okay, really.
Yeah. And Barry, what was your experience?
The same as Nigel regarding the numbing for the cystoscopy was the only mild discomfort. TURBT was a spinal, knew nothing really about that, didn't feel anything, and was discharged the same day.
And Janet, when you were given the results of the test, who gave them to you and were they made easy to understand?
The clinician that did the cystoscopy actually showed me the tumour on the screen and then afterwards explained to me very clearly about the sort of development and staging of bladder cancer and what would be the next course of action for me. Once the tumour was removed and the pathology results had come through, then the diagnosis of cancer was confirmed at a clinic appointment with a nurse specialist, a similar role to what Helen plays.
And were you given or offered any support at that stage?
Well, the clinical nurse specialist acts as the first point of contact with the patient, which is, I think, very comforting, and you've got someone there to ask questions that you have. If you're diagnosed with cancer, you have to learn to live with the unknown. And I also benefited from some counselling sessions with Macmillan nurses, and also I've done a couple of mindfulness courses which I found really helped me during my cancer journey.
And thank you everyone. So in our next video we're going to be looking more closely at non-muscle invasive bladder cancer and the treatments that are available to the urologists.